Can individuals with Asperger syndrome lead a productive life? Asperger syndrome has been the subject to numerous studies and ongoing research due to the fact that individuals with this disorder face many obstacles in everyday life. There are strategies and interventions that parents and teachers can use to help children and adolescents who face the obstacles of Asperger syndrome accomplish their goals and have a productive life. In this presentation, I am going to explain the importance of ongoing support and interventions needed for a positive outcome of individuals with Asperger syndrome. Here is a handout I would like for you to have. We will be going over some of this information a little later in the presentation. What is Asperger syndrome? Asperger syndrome is a neurological developmental disorder that affects an individual for a lifetime. Individuals with this disorder display a range of characteristics. According to the National Institute of Neurological Disorder and Stroke, one of the most recognized characteristics is a child's preoccupation with a particular item or theme. The other characteristics include poor social interaction, impaired communication, repetitive behaviors, and delayed motor skills. Now that you have a better understanding of what Asperger syndrome is, let's talk about some of the obstacles that individuals with this disorder face. Some of the challenges that individuals with Asperger syndrome experience throughout their life include not being able to comprehend the viewpoints of others, inferring and assuming the intentions of others, evaluating another's well-being and values, and they often don't acknowledge the thoughts and feelings of others. These challenges are a result of difficulties they have with social reasoning and adaptive behavior. If early interventions are not implemented, the overwhelming feeling that they face on a day-to-day basis can lead to other disorders such as depression and anxiety. It is very important that we try to prevent the occurrence of these disorders by implementing interventions early on. According to research done by Lee Wilkinson, these are some of the most successful interventions available. The first one is skill-based training. Skill-based training is a program that provides methods that focus on social rules, which include the proper way to greet, the importance of eye contact, and the correct way to interrupt. The next one is social stories. Social stories are stories that teach social behaviors. These stories give examples and explain social rules and perceptions. Wilkinson also suggests social autopsies. Social autopsies teach cause and effect. The last method that I want to talk about is self-talk. It is recommended by Kohler-Stock and Huddling. What it does is it helps the individuals control their emotions by asking themselves a series of questions such as why, when, and what. For example, if they are feeling angry, they can ask themselves, why am I feeling this way? When did I start feeling this way? And what will happen if I respond this way? I found this method to be very important because through self-talk, they will become accustomed to evaluating the response options and be able to respond appropriately in the future. In addition to these interventions, I want to share with you some helpful strategies. These strategies can be used on a daily basis, and they were provided by Rosalind Lord, a mother of a child with Asperger syndrome. She found these strategies to really help. This list contains a variety of various strategies such as remember to keep speech and instructions simple. It is important that you ask them questions to make sure they understand what you are talking about. Encourage eye contact and explain to them why they should look at you when you are talking to them. Turn-taking activities teach the importance of waiting. Try to pinpoint stress triggers and avoid them if possible. And always be ready to distract them with something else. Slowly build flexibility into their routine. If you teach them that things can change without warning, this will help. Last but not least, because they have difficulty with change, it is very important to pre-warn them of any changes that are going to happen in their daily routine. These, as well as other strategies such as the ones provided in your handout, are helpful suggestions that parents and teachers can use to help assist a child with Asperger syndrome. For additional information, please refer to your handout. It provides additional helpful strategies and contains a website that you can go to find out more about Asperger syndrome. In order to help an individual with Asperger syndrome succeed, we need to make sure we fully understand the aspects of their condition and how it affects their life. Because this is a lifelong disorder, they will need ongoing support and interventions. If parents and teachers work closely together To implement the strategies and interventions provided, they will greatly impact the life and success of an individual with Asperger syndrome. Does anyone have any questions?
How is Asperger syndrome diagnosed?
There is a two-stage process in determining if your child has Asperger syndrome. The first stage includes a screening process using a parent survey and clinical observations, which indicates taking your child to your family doctor for developmental screening. The second stage is an evaluation that is formed by a team of specialists such as a psychiatrist, a psychologist, a neurologist, a speech therapist, and other professionals that diagnose children. Any more questions?
Why are some children not diagnosed until they begin school?
Some children may function at a high enough level that the signs of Asperger syndrome are not noticed until they are in a classroom setting with typically performing peers of the same age. If there are no more questions, I would like to thank you for your time and undivided attention. But before you leave today, I want to leave you with a quote by Rosalind Lord. One thing we need to remember is that they are children like the rest. They have their own personalities, abilities, likes, and dislikes. They just need extra support, patience, understanding from all those around them. Thank you.